welcome, Phil. Thank you so much for coming. Phil is the chair of the NHS Food Review and works for NHS estates and facilities. He's going to give us a chat about great food, good health, the NHS England food programme. He's been doing a lot of really good work.
Thanks, Leslie. It's brilliant to be part of today, and I'm away at the moment, so but managed to dip in and out of a few meetings, and you know it was great what Elise is just it was great of what Elise was just sharing about, you know, trying to make food and drink is a sense, you know, that sense of fun, isn't it? I must admit, if I ever drunk a hot cup of tea, that would be a bit of a one-off. I'm drinking cold tea nearly all the time, and we take it for granted, don't we? But by giving our patients our drinks, and yet not giving them the time and the enjoyment to actually drink it at a pace and a temperature that they want. So now, thank you, Elise, for sharing that, and Leslie, thank you for involving me in today. I feel absolutely privileged to be involved in Malnutrition Task Force, and it's great that we have these awareness opportunities to raise the profile. And I hope that, you know, today I can just share a few things really around the challenges that we've been facing, but also about some of the momentum that's taken part and the support from people like yourself and Diane, as well as people like Prue and Dr. Rupi, that are kind of given us encouragement and guidance in where we need to be. And particularly, you know, with Diane having gone through, you know, the chairing of food standards in the past, that sort of experience is so important that we should listen to what's gone on before and how we can sort of pick up the baton and take it forward. And before we go into slide 2, you know, it's important to recognise that we've been very fortunate this time around, at least with a review that took place after such difficult circumstances. We have a programme that's in place and supported by the Department of Health, and this is driving a number of key areas that I hope will bring improvement. So I'm just going to quickly skim over a couple of those areas and let you know what we're trying to do in these parts. So if we go to slide 2, that would be great. Thank you. So we had 8 recommendations from the food review. Nutrition, hydration, you know, trying to strengthen the role of clinical, of dietetics and of allied health professionals. What's our awareness like at ward level? We know it's inconsistent, so how can we drive that consistent pattern? Ensuring that food and drink is part of clinical training. And I know that Rupi, through the whole Doctor's Kitchen, and we've also got NutriTank, they've been working with clinicians to ensure that that is very much part of their schedule. Technology, we're driving a consistency of information through electronic meal ordering. We know that digital strengthens the link between trust teams. You know, that's in a number of ways, either through the clinical pattern or through cleanliness, but also through food ordering and through food wastage. So how can we support that management? How can we understand nutritional, allergy, and availability and choice of information? Facilities was probably always going to be a big area that we would, in a way, struggle to sort of change the demographics of where we are. What we are able to do is influence all new buildings, so there is sufficient space, equipment, and facilities. So we're looking after our teams as well as our patients. You know, so it's health enhancing, ensuring that we have choice, availability, and supportive surroundings for each other as we care for people. Food safety, we know, was the big driver behind the food review, and although we were asked to take on a number of other areas, we have to understand that food safety in healthcare needs to be absolute paramount. We should be leading the way. So our strong connection at the moment with the Food Standards Agency, our suppliers, our FM providers, and NHS supply chain. We need to understand that trusts have a nominated food safety specialist, so there is real responsibility around effective compliance. Sustainability and waste. Well, strong working relationships with DEFRA is enabling us to talk in depth around food waste management, but also around the consultation for the government buying standards for food and drink, as well as things like providing advice to Love British Food on local procurement and the SMEs to ensure that everybody gets an opportunity. Next slide, please. So enforcing standards was again a key area for us in the review to ensure that, you know, this was not a one-stop drop. We're currently awaiting the launch date and arrangements for the new food standards for healthcare. And within that, there will be 8 mandatory standards that are listed, and they are linked to the review to ensure that we have that momentum that's been built up. This will be managed through the standard contract and monitored by the CQC. And what I will do after today's session, I'll share these, the 8 mandatory sections with Leslie, so she can at least share these with the wider teams. Catering staff support. Well, we want to recognise excellence. You know, we've got a skilled workforce. We need to celebrate success, but also call out those that are not responding to the challenge. NHS Chef 2021 was a huge success. We're approaching the finals for 2022 right now, and they will include challenges on breakfast, on children's menus, on our cultures and our lifestyles, innovation on value meals for staff, particularly in the current climate. We're looking at things like pilots, innovation around crockery and around the use of venison and game within our menus, as there is a real opportunity to integrate that into our public sector. And going forward, well, what we wanted to say is, you know, how do we take the program forward so people understand that we are involving everybody? How do we maintain a profile and a momentum of change? So we have this 3-year program. We've got key target areas, and the food expert group are ensuring that the partnerships, the leadership, and the togetherness is there for all to see. Next slide, please. And just picking up on exemplar trust, you know, we need to create beacons within regions. This provides us with examples of excellence. So it gives support for individuals and teams, and of course, centres for pilots and opportunities. Many trusts want to be a flagship. They want to show within their region that as a catering exemplar, they are leading the way. And we want them to be able to share that information with those trusts in those same areas that are struggling, so we gain a little bit of consistency. And the next slide, please. So what are we learning? Well, we need to understand the people that we serve. So raising the profile of our roles in the NHS, that continues to be a challenge. Of course, the political noise often drowns out what I would call the realness of the job that our colleagues undertake. We're not only caring for the vulnerable, the young, the elderly, the malnourished, and of course the sick, but we're also caring for each other. And NHS teams have never been so important as right now. And having worked constantly through a pandemic, we need to value their commitment by providing suitable facilities within the provision of food and drink at all times. And what does exemplary actually mean? Well, being able to excel in the role that you provide within healthcare is a fantastic achievement. We all know colleagues and individuals that provide a model of excellence. We're providing a number of catering exemplar trusts that share with confidence, you know, knowing that our teams are working in partnership, putting the patient at the centre of their decision-making for food and drink. And to finish up on that, why is leadership ever been so important as right now? Well, if we are to make appropriate steps of success, We need leaders that are courageous and loyal to their belief. All of our exemplar trusts are supported by the board in their ambition to drive the importance of food and drink. We are constantly looking for strong and honest leadership, believing in their strategy, their delivery, and their outcomes. I believe that our programme will drive the necessary behaviour to bring positive results. I hope that gives you a brief overview of what we're trying to do. And if you finish with the final slide, you can see that, you know, our way of celebrating food is often to bring chefs together, to give them a challenge and to see them learn from those challenges, rise to the top. And we've had our 16 chefs from last year. We've got 16 this year that have got through to the finals, and we will continue to drive that behaviour, that excellence needs to happen within healthcare. Thank you.
Oh, well done, Phil. That's brilliant. It certainly made us think, isn't it, about how important good leadership is. If we don't have good leadership, we're never going to move on. And you've come such a long way and you're doing such a good job. So well done. And thanks so much for giving your time today. I know you've been really busy.
No, you're welcome. Thanks as ever for the invite. And I look forward to the rest of the day. I'll be listening in. Thank you.